It's still going. They've got to be close to the record for the longest hair. Something that long must have been there years. Here's the first one. This shouldn't be done at home. This should be done by a medical professional whenever you stick something in there, okay? Now, this guy has an ingrown hair, but there's not a lot of redness and inflammation. It's been there a while, so he's gently teasing it out. So let's check it out here. Oh, he's got part of it out. So now the key is to take a piece of tweezers and gently pull. Look at the length of that baby. Whoa. Whoa, it's still going. So that one must have been there for like a year. And that can stay dormant like that. Okay, here's the next one. Now he's doing it himself. He found it, so he's pulling it out himself. Woo! Ah! Whoa! It's still going. Whoa, it's still going. They've got to be close to the record for the longest hair. Something that long must have been there years. Not just 1 year, but years. Oh my God, it's in the eye. Oh my God, it's in the eye. Ah! It's in its eyeball. This is really tricky. This should be done by a doctor, nobody else. He's pulling it out, pulling it out. Oh my God, there are 2 strands there. That's a little crazy. Okay, so here's a huge ingrown hair. Look at that. It has a dome to it, so it's obviously been there for a while. It's in a person with curly hair, thick hair, which are more prone to this. Some individual hairs have 4 or 5 bulbs together, so sometimes you get a really thick piece here. Oh my God, look at that. It's coming out like a tree. Look at that, it's a bush. He's pulling out a bush out of this guy's head. And it's got some keratin, some cheesy white material around it. Wow. Look at that. Sometimes has a plug, and now it's got a longer strand connected to it. Wow, that's been there for quite some time. This looks like they're pulling out regular hair, though. It doesn't look ingrown. Looks like they're just pulling out regular hair. This person had a hair transplant and had plugs. These look very thick. This is like the old-fashioned method that could look very pluggy and very thick and doesn't look very natural. So they're pulling out the hairs of this old hair transplant, what it looks like to me. They don't really look like you're getting the tip of the follicle either. Usually it has more like a white ball at the bottom of it. So this looks like a real thing to me here, where you can develop like a keratin plug around it, which can happen, especially if it's been there for a few years. Here we go. Whoa, okay. Got part of it. Still a little bit left there. Okay, that's what it can look like. It can look like a blackhead or pimple if it's been there quite a long time. There, they popped it out. They're trying to get the rest of it out with tweezers. Trying to grab it. It can be difficult to grab. Sometimes it stays there longer. That's what a normal, average ingrown hair looks like. Okay, so it can look like this blue thing there. So you can get the piece of it out. So this claims that's been there for 9 months. Whoa, baby. Whoa, baby. Whoa, baby. Whoa, baby. There you go. So I would say that's fairly accurate for 9 months, the length of that, but there's still some left over. Getting more here. So the average growth is a ½ an inch a month, but some people can grow longer, some people can grow less. And wow, look at that. That looks like it's been longer there than 9 months. Here's a keratin plug one. That looks like it's been there for a while, like it's been dormant for a while. It's not red, inflamed, or infected. So with a good piece of pliers or tweezers like she has there, this could be a good one to take out. You can see the cheesy white material, which sometimes happen, the keratin around it, which tells us it's been there for a while. Slowly prying it out, All right. That's a normal ingrown hair. Okay, so it looks like this, like a blackhead. That's a typical presentation of it, especially when it's not inflamed or infected. It can be dormant. Sometimes they can get inflamed or infected and be dormant. Wow. Oh boy, he's pulling a big one out of there. That was a big, nasty one. It was there for a while. That's why it has some keratin around it as well. Okay, here's another one. Got a little loop out of there. It's in the underarm. This can happen wherever you have hair. It can happen in the groin, back, arms, head, feet, wherever you have hair. Whoa, look at that. Pulling out a lot there. That's a big one. So that's been there for a while. And there it is. Beautiful. So let's see this one here. This one's weird. It's like superficial underneath the skin. This is a little strange. Usually it doesn't grow like that. It doesn't grow superficial like underneath the skin like that. I have to say is a little weird. Doesn't make quite sense to me. Okay, so here's one here. Looks like a blackhead. It's a typical appearance of an ingrown hair many times. So they got this dental instrument to loop it out. Now they're taking tweezers to pull it out. Some keratin stuff in there. And that's normal. That's what the average ingrown hair looks like. Trying to get a piece of it out. Yep, keratin stuff around it. And voila. Nicely done. Very nicely done. Got an ingrown hair here. It looks like a blackhead. Got a piece of it. Now it's coming. It's coming. Ooh, yeah, baby. Ooh. Woo! That was a good one. Alrighty, here we go. That has a little inflammation to it, a little bit of a blackhead. That can be rather painful when it looks like that. It looks like they are in a doctor's office using instruments, gloves, sterile material. That's good. That's good. Gently pulling on it. Got the plug. It's got some keratin in it. And gently pulling it out. Trying to get all of it. Looks like he's got it. Nice one. I'm sure he's relieved that's gone. That looks like he's trying to get another one, but it's not coming this time. Sometimes they have to mature a little bit and get closer. They go underneath the skin, difficult to reach them. The body will push part of it up and form like a blackhead. Okay, that's a normal one. Been there for a while with a keratin plug. So you basically pop it out like a zit, and then you grab it and then pull it out. Gentle pressure, try and get all of it out. Don't leave anything behind. Here's one on the foot. Now, this is really rare. It's a little strange, and this can be painful in the foot. Usually, they don't grow horizontally like that, just underneath the skin. That's kind of weird. And so there you have it. Hope you enjoyed this video. I'm Dr. Michael Gartner, double board certified plastic surgeon and physician. If you like this, hit the subscribe button, and there'll be more videos on the way.